Hey guys, Dr. Christy Ennis. Core exercises are awesome for the back. However, if you have back pain currently, sometimes those traditional exercises really don't feel so great. So we've got 5 exercises today that activate all the muscles that help support the back without causing pain. And the cool thing is you can use them even after you're out of pain to continue to get stronger. For your first exercise, you need a band and a wall, or at least something nice and sturdy to stand against. So back is going to go flat against the wall. You're going to bring those feet out as far as you can, keeping that back flat because we're going to slide right on down. So step 1 is actually pulling out against that band a little. Your knees will bend. Feet are going to stay flat though. Don't let those feet roll out. So now we're activating the outside hip muscles. And we're gonna now slide it on down. So those hip muscles have to work a little bit harder, but the back is supported. So that's why this one generally feels better than a squat does. Go down as far as you can, pause for a couple seconds, keeping that pressure on the band, and then slide it right on up. Goal is to do about 10 to 15 of these. You wanna feel a little bit of shake in those legs, but you don't wanna have pain. All right, next exercise, you need a band and again, something to loop it over. If you don't have a lovely metal railing like I do, oftentimes you can put a knot in your band and slam it in the door, or you can even hang it over your railing if you've got stairs. So you're gonna stand with those feet about hip width apart, slight bend in your knee, just kind of an athletic stance. Hands are gonna come down your side, by your side, palms facing down. You really wanna think, gently pull in that belly button to engage all these ab muscles. I'm gonna do a gentle shoulder blade squeeze back, and then it's a pull back. So I'm using my lats and my abs right now to give extra support to the back. So we've got support from above and below. If you want to make this a little bit more challenging, come to where you have some resistance, and then you're going to add a little pulse here. You're even getting an arm workout at the same time. So if you're doing those little pulses, shoot for about 20 to 30. If you're sticking with just that regular pull back, shoot for about 10 to 15. Okay, our next exercise really focuses on those outside hip muscles. I am lying on a mat to do this, but you can definitely do this one right in bed. When you have back pain, sometimes it's not very comfortable to get up and down off the floor, and I totally get that. So feel free to stay right in bed to do this one. So first step is getting our position in the correct spot before we even start the exercise. So you want to make sure you're rolled all the way over onto that hip, not rolled backwards. If that's uncomfortable, you can put a little bit of a towel or a pillow underneath there to help support it. Step 2, you should look down and you should see your toes and your feet. You can give a little kick and wave there with them, but not much of your leg. If your legs are, if you can see those legs, it usually means they're too far forward and you're going to be using your hip flexor muscles more so than these muscles we want to target to support that back. From here, you want to lift that torso away from the mat a little bit. I always say it's like you have a cupcake there that you don't want to smush. My favorite is vanilla and vanilla, and I don't want that smushed. That hand, that top hand's going to go down on the mat as well. And same thing, you don't want to smush a cupcake here either. Choose your second favorite cupcake. Mine is carrot cake with cream cheese frosting. And then we can actually start the exercise. So bottom leg can stay straight, or you can bend it. I'm going to keep mine straight. You're going to bring that leg, that top leg back just a touch so that you're touching that heel. I'm going to turn my toes down towards the floor without rolling forward. And then I'm going to lift. Notice I'm not lifting very high, but I'm really engaging these muscles here on the side. You're going to shoot for about 10 to 15. Goal here is to go until it feels like, whoo, those muscles are getting a little bit tired, but not sore. If you have any pain, check your position first. And if you still have pain, please stop. Also make sure that you are doing this on both sides. And if it does happen to bother you to turn those toes down, totally fine to keep them straight. Just don't let that leg swing forward. Next one, focusing a little bit more on those deeper abs. Again, you can stay right in bed. You don't have to get down on the mat. But we want to think about activating those abdominal muscles first before we move anywhere, because that is what they're supposed to do. So you're going to think about gently pulling that belly button in towards your stomach. It's not a pelvic tilt as you do this. Just keep that in mind. It's just a gentle little pull in. You're going to keep your back in a position that is comfortable for your body. So that doesn't necessarily mean all the way flat, because our spines are all built a little bit differently. It's where you feel comfortable, but that's where you want to stay. You don't want to move out of that position. I'm going to put my hands on the ground and actually gently press in to activate my lats again to get a little stability from above. And then while continuing to breathe, that's the other step, you're gonna take one knee and lift up towards the ceiling a little without moving any other part of your body. And you're alternating here. If you're not sure whether you're moving or not, you can take those hands and place them right on your hips. That'll give you a better understanding of whether you're shifting around. And then you can go ahead and place those hands back down on the ground again to activate those lats a little bit. So step 2, or a little bit harder, level 2, would be bringing those arms up above. And then as I lift my right knee, my left arm is going to go back. So the more body parts you add in, the more difficult it is to stabilize through that center. And kind of level 3 of this, which don't do this until you really feel good, making sure you keep those abs activated. If you bring both feet up, we're going into that modified, or I should say, really not even modified anymore, but that dead bug, or as it's been renamed, the struggling turtle. And same idea here. You can start with a bent knee, which is a little easier, and then you can go right into that straight leg. So multiple options here, but definitely start to make sure that we activate everything right with that little march on the ground, and about 20 total. Our last exercise works those smaller muscles in the back, which again are stabilizers. So you're gonna go in a hands and knees position, or quadruped as it's called. Again, you can still do this one in bed, so you don't have to get down on the ground. Hands are about shoulder width apart, thinking of course of engaging that belly button first. This time you wanna think about trying to squeeze those glutes a little bit. Gently squeeze those shoulder blades so we're getting all the stability that we can. And I'm gonna take this left leg and I'm gonna tap it out. Tappy, tap, tap. See if you can guess what movie that's from. And we're alternating here. So try to keep your weight shifted evenly on both hands. Sometimes it's easy to shift right on over. The other thing that's important with this one, besides keeping everything engaged, is making sure that you're not arching your back or dipping those hips, wiggling them around. So you can have somebody else take a look at you as you're doing this, or I'll sometimes have people put a broomstick across their back, a yardstick across their back, or if you have none of those options, even a cell phone. That way you can tell whether you are tilting or not. So this again is kind of the level 1. Level 2 would be still keeping that contact with the ground, but adding an arm as well. All right, so notice I'm not lifting everything up yet. Once that feels easy, then you can go ahead and do that traditional bird dog, which is where you're actually lifting off the ceiling, making sure that you are still keeping everything engaged and alternating, because that's kind of how we walk, right? Alternating arm and leg, opposite arm and leg. And same idea, shoot for about 20 total.